creating cultural awareness and understanding. This is Culture Clique. Culture Clique is written and produced by KQAL FM on the campus of Winona State University.
Today on Culture Clique, we continue our series Legalizing Recreational Marijuana in Minnesota, and today we take a look at the health risks associated with the recreational use of marijuana as we speak with Dr. Frank Bures, Nurse Donna Kamann, and Kelsey Martin. Dr. Bures is a dermatologist with the Mayo Clinic Health System La Crosse and a columnist giving medical advice in several local newspapers for 42 years. Donna Kamann works as a family nurse practitioner and medical herbalist at the Tincture of Thyme Healthcare Clinic in Winona, Minnesota. Kelsey Martin works as not only a licensed clinical social worker, but as a licensed alcohol and drug counselor for the Winona Health Behavioral Health Team. I'm Dylan Alzate, and I hope you join us as we talk to these three medically experienced individuals about the health effects of recreational marijuana today on Culture Clique. Would you feel comfortable stating your name for the recording?
Yeah, it's Frank Bures. I'm a dermatologist, but I have written a medical column for 42 years for local newspapers.
Awesome. So as a medical professional, what has been your experience in the field when regarding marijuana use?
I haven't had any direct patient contact, but I certainly read about it, and it's interesting how it's hard to know how to think about it. But I know in Minnesota, the police are gearing up to have tests when they stop drivers to see why they're driving erratically, and see if they can measure their level of cannabis in them, probably principally THC, tetrahydrocannabinol. But it has some negative features. In teenagers, it can affect how brains develop. That's documented. It can't alter how you drive. And if you're smoking a lot, it affects your lungs as if it were cigarette smoke. It damages lungs a whole lot.
Really?
Yes, absolutely. No question. That's well documented. It's the most commonly used federally illegal drug in the United States. That means illegal according to the U.S. rules. One reference I have says an estimated 48.2 million people were using it in 2019. So there's a website from the Centers for Disease Control and Prevention, CDC, and it really is kind of a nice range of things. And you don't have time to go through the whole business, but they're categorized with addiction, cancer, heart health, mental health, poisoning, risk of using other drugs, and how it affects teens, and brain health, driving, lung health, pain, and effects in pregnancy. And then there is effects from the secondhand marijuana smoke, like there would be from the secondhand cigarette smoke. So it has a broad range of medical issues associated with it.
Yeah.
It's like a glass of wine or a glass of beer. Once in a while, that's not going to affect a whole lot. But if you consume a lot, it's going to have different medical effects as well as psychological. It has a lot of issues connected with it. The social issues are different than the medical issues, but they're tied in. And if you make it illegal, then you make a whole bunch of people criminals, and a lot of people are in jail for that. And the question is if they really ought to be. They're not the ones that are selling it, they're the ones that are using it. So,
yeah.
That's a long answer to your question.
Well, I appreciate the deep thought.
Yeah, so it's a drug, and how problematic it is another thing. In cannabis, there are over 100 compounds. They're different cannabinoids, and some are mind-altering, like THC is the premier one, whereas if you have this other one, you can pronounce it CBD, which is cannabidiol or cannabidiol, there's no mind-altering effects. So you can't get a, quote, high off it.
Is there anything else that you feel that is important to address?
No, but it's not a good thing to make it illegal so that anybody having any of it is a crook. That's not a good thing. We went through that with alcohol, but alcohol was not a benign drug at all. There are alcoholics. There's Alcoholics Anonymous. It's regardless of how many bars there are, it's still a drug and it can still have deleterious effects. So marijuana is kind of the same way, but making it, criminalizing it doesn't make any sense in a lot of ways because you're needlessly putting people away. You need to put money toward ways to help them if they get in trouble.
Yeah.
Not more jail cells.
All right. Well, Dr. Bures, thank you so much for joining us.
Sure, you bet.
Yeah.
No question. I hope it's of some help.
After talking for a while with Dr. Frank Bures, I went to have a chat with nurse practitioner Donna Kamann. Thank you for joining us today.
You're welcome.
Just for clarification, I'll just grab your name and your occupation.
My name is Donna Kamann. I'm a nurse practitioner in family practice and have been in palliative medicine in the past. I am also a practicing herbalist.
Awesome. So, how long have you been practicing that?
I've been a nurse practitioner for 18 years, and I was an RN for 12 years prior to that.
Awesome. So, what is your history in dealing with patients who may or may not be users of marijuana?
Yeah, that's a good question. So in most of my career, it's been illegal to use marijuana medically. 1970, it was listed as a Schedule I drug from the government, meaning you had no medical purpose and you couldn't prescribe it. So for most of my family practice time, I never used it. And then when I went into palliative medicine, I could use an oral chemical form and pill form for people that had cancer, and we would use it to potentiate their pain medicine. So if somebody was having a lot of pain and we gave them pain medicine and they still weren't getting comfortable, we could use oral Marinol. We could also use it for nausea and vomiting, or for people that weren't hungry after getting chemotherapy.
Right.
But I would say in general, it wasn't something that we prescribed, or that I prescribed it, that people around me prescribed it, but many of my patients used it.
Okay.
Yeah.
And what would you say would be the positives of using marijuana?
Yeah, so I can talk a little bit about the plant, and I'm going to do that because I think it would be helpful.
Okay.
The plant itself has been used for medicinal purposes, for food, for clothing, for over 6,000 years. And the primary reasons that was used was for pain relief, to reduce inflammation, as an antispasmodic, as a sedative, and as an anticonvulsant. So those things are still really popular reasons to use it. It provides some pain relief. If you give it to people that have a lot of pain and they're taking pain medicine, it seems to make the pain medicine even stronger, so they get better pain relief. It does help reduce inflammation. So for people that have chronic inflammatory problems or autoimmune problems, it can really reduce those symptoms. It's also antispasmodic. That's probably more important for the THC component than the CBD component, so you need to have a mix of the two. But then you can use it for seizures, tics, spasms, muscle spasms, for multiple sclerosis or ALS.
Right.
People also use it very effectively for sleep.
Right.
And
yeah.
anxiety, post-traumatic stress, OCD.
I have a few friends that use it themselves, and they've all been telling me that that medically it helps, that it would help them for stress relief or antispasmodic, as you said before. Mm-hmm. So that's really interesting to hear. So on the other end, how would you say it would provide some negative health effects for users?
So I'm going to talk again about the plant for just a few minutes.
Okay,
so
go ahead.
Plants grow in environments that are filled with stress, the same as we have, and they make all of their own chemicals to survive and thrive in that environment. They are very generous about sharing those chemicals with us, and our bodies use them readily. So if the plant is making an anti-stress chemical and we take it in orally or smoke it, it works for us. We also make our own anti-stress chemicals and anti-pain chemicals and anti-inflammatory chemicals. The longer we use cannabis products, the less we make our own endocannabinoids, they're called. So in some of the literature I've read, and I think that this is true, if you use a product with THC in it for more than 2 weeks on a daily basis, you stop making your own feel-good chemicals, which is unfortunate, because then if you stop using the product, you're going to have a withdrawal and you're not going to feel good. So it's important. It's considered one of the power plants. Like, it can change you. It's a sacred plant, and it's not meant to be used daily for everything. It's meant to be used in small amounts and for specific reasons. In my opinion, I guess that's an opinion.
Yeah.
But if we use it persistently, it becomes necessary, and we don't want to be needing something that our own body could do on its own. Right.
And would you say that this could lead to users to have a sort of addiction?
Right. It's habit forming, and also the longer you use it, the more you need to get the same effect.
Right. Right. And the more you use it, the less you're able to produce any of your own.
Right. I had the interesting experience of being at a dispensary in Michigan right after it became legal. And they were selling their products very strongly as something you would take in the morning to wake up, something you take to focus during the day, and something you would take to unwind in the evening. The plants have been genetically modified to have different properties now, and so they're selling that plant to be used for everything.
Right.
Like, you can't live without it, right? I think that's a huge mistake. I mean, it teaches you that you can't live without the plant.
Right. Yeah. I get that. Like, you can build these chemicals without it, and having a sort of, and the plant that's not really supposed to be used for an everyday thing. And now, it could literally be used for everything.
Yeah.
What's the use if you can just build those chemicals on your own?
Right. You don't want to do that.
Yeah.
I mean, the best way to take care of your own health is to eat a healthy diet, get good sleep, spend time outdoors, get exercise, and move every day. I mean, and have a connected social life. Those things are all, we understand that. It's the easiest way to own our own health care.
Mm-hmm.
I love that people are using plants for health care, and they're taking their own health into their own hands, but nobody would want to take something they didn't need day in and day out, especially if it's expensive. And there's no reason to use cannabis any differently than you would anything else.
Mm-hmm. Would insurance be able to pay for marijuana?
Right now, I don't believe you can get insurance to pay for that.
Okay.
Yeah. It's still illegal at the federal level.
Mm-hmm.
Yeah.
Yeah, so in a way, still, insurance companies would still, back away from that until at some point when they have a way to push for it without getting into any sort of legal trouble.
Right.
Okay. Outside of medical treatment, how could users use marijuana recreationally and yet responsibly? Or
that's
use
such
it?
a good question. I will tell you, I think it's dose dependent. I'll speak personally, actually. When I was a young person in high school, it was very common to smoke pot, and I would consistently get sick from it, really sick from it, vomiting, lose consciousness. And I never really understood that I was basically overdosing. So with all drugs that we give people, I always recommend starting low and going slow. So if you take a beginning dose of something like an oral cannabis product, you'd start with like 2.5 milligrams, maybe half of a gummy or half of whatever they come in. I don't buy these, so I'm not very helpful with this. But then you'd wait for that product to take full effect. And in an oral dose like that, it might be 45 minutes to even a couple of hours. And the effect would last for 4 to 6 hours. So if you want to start with something, you'd start low, give it full time to work. And then if you still don't feel anything, you could dose a higher dose. So if you're smoking pot, you might want to just take one hit off of a joint and wait. Smoking, it's the quickest way to get it into your system. It takes about 10 minutes for something inhaled to hit your brain and tell you what it's doing. Right. But maybe just one puff of it, wait 10 minutes, 15 minutes and say that's enough or that's not enough and take a second puff. But don't smoke the whole joint because it might be too much for you.
Right.
So, yeah.
The big goal here is to get a medical doctor's perspective on the recreational use of marijuana.
I guess, basically if I know a patient is using alcohol in excess, it's not my primary concern when I see them. My primary concern is how are they doing overall. If their blood pressure is real high, I'm still going to treat their blood pressure. If they don't sleep well, I'm going to help them sleep well. If they don't have an appetite, I'm going to help their appetite. I mean, I'm going to do everything I can to make them feel good. And I'm going to try really hard to not let their alcohol use be something that I hold against them or don't treat them for. It's the same thing with cannabis. I mean, people have historically been very private about their cannabis use because it's been illegal. So if a patient comes in, they don't typically tell you if they're smoking pot. I think people are probably more open about that now, and in my current practice, people tell me what they're doing because I'm not in a mainstream practice. So if somebody comes in and they're smoking pot regularly, that comes out, they tell me. If they're using herbs, whatever they're doing, they tell me about because I'm not in a mainstream practice. And then that helps me figure out what I can do and not do to treat them and keep them safe. But basically, I think probably the legalization of cannabis, if anything, impacting the healthcare system is people might be more open about talking about it to their providers. And basically, I think that's good because as a provider, you can't make good choices if you don't know the full story.
Right.
So if they're using it just for recreational purposes and they sit down and tell me I'm smoking pot every day, I might ask them, are you worried about that? Are you still finding other ways to bring yourself pleasure? Do you feel like you can't get enough of this? Is it interfering with your ability to function in other ways? Mm-hmm. And if it is, I might refer them on to drug counseling, like I would if they were having the same problem with alcohol or heroin or anything else.
Yeah. That's actually a really good point. Like how it'll affect the way patients approach their doctors, especially so because it's been illegal for quite a while. You did mention that medical and recreational are completely different things. Do you think we can kind of elaborate on that? Sure.
I mean, I think of recreational cannabis use as something people do to have fun.
Yeah.
And that's one person's fun is not my fun. I don't find it fun at all, so I don't fully understand that, but I don't really think it's fun to be out of control of my own thoughts. So drinking heavily isn't fun for me either. I might not be the best person to ask about that, but I think that if people are having fun with it and they're keeping it in check and they still have functional lives, more power to them, especially if they grow their own plants and make their own fun, because I think it's just good to do that. But for medical reasons, there are a lot of ways to treat anxiety or pain or inflammation. that are effective and don't have some of the drawbacks to using cannabis. As a practicing herbalist, when people come to me, it is not my first choice because I do think it's a powerful plant and I think it's being misused at so many levels. And I also think it's really being used for money. And I think that makes it dangerous.
Yeah, like there are many ways to use cannabis that some aren't really the best practice.
They're not. So I tend to use other things first that I think are going to be effective, safe, not habit-forming, not expensive, and just lead to a healthier outcome overall. That's me. There are other herbalists that really love working with cannabis and use it regularly for their clients. But yeah, I think there's a place for it. I also think there's a time that it's probably not the best thing in the world.
Right, yeah.
Yeah, one other thing that I realize as we're talking about this,
Yeah.
and I'll speak directly from the medical industry, because it's been outlawed and listed as a Schedule I drug for so many years, none of us uses it regularly, and it's not something that's like right front and center in our repertoire of what we would use. So if somebody came into me and said they were having nausea and vomiting from chemotherapy, I would definitely try an antiemetic that's standard before I would even think about using cannabis, even though cannabis might be the more effective drug.
Right.
So I think over time, as the culture shifts around the use of it, it becomes more legal in more places. If the federal restrictions are lifted and it comes off the Schedule I drug category, you'll see it used more in practice. But I don't think that's going to happen anytime soon. And still in Minnesota, you have to get a certification to get medical marijuana. That marijuana is no different than what you can buy in any dispensary downtown right now, so it's not a special marijuana. It just says that you meet the medical criteria, and there's just a list of diseases that are on that.
Yeah.
Do you want me to read those real quick?
Yeah, why not?
I mean, they're easy to find, but they can be used for cancer, glaucoma, HIV, Tourette's, seizures, epilepsy, chronic muscle spasms, chronic or acute intractable pain, MS, ALS, irritable bowel syndrome, Crohn's disease, autism, post-traumatic stress disorder, obsessive compulsive disorder, Alzheimer's, obstructive sleep apnea. That's it.
And you said that this information can be found very easily?
Yeah, if you Google Minnesota medical cannabis.
Okay.
Yeah. You know, I'm going to just mention something a little bit more about what we call our endocannabinoid system.
Yeah.
So we don't fully understand all the hormones in our body and how our bodies regulate, but there's something that was discovered in the 1980s called the endocannabinoid system. And basically, it's receptors in our body that bind to cannabis or cannabinoids. But they also, within us, we make our own cannabinoids. And they help regulate homeostasis or balance in our body. They regulate pain. They give us a perception of well-being. They influence our learning, memory, and consciousness. They impact our emotional health, our appetite, our immune health, and our reward system. So if you can take a plant that attaches to all those receptors, you can see how it can powerfully change your body.
Mm-hmm.
Yeah.
Wow.
Yeah.
That's awesome. Well, Donna, thank you so much for joining us today.
You're welcome. Thank you for having me.
After wrapping up my conversation with Donna Kamann, I went to Winona Health to talk to licensed alcohol and drug counselor Kelsey Martin.
What are the negative side effects of marijuana use?
So marijuana use is a little bit different from some of the other drugs that we look at, but we still have, with some of the different ways that marijuana is being utilized now, between vaping, any concern that comes with vaping, we still see with people who are using cartridges for marijuana use. So the added chemicals that are in there are going to have health concerns. You're still adding smoke to your body, and so the concerns that come to your lungs with adding smoke to your body. And then one thing we always look at too is any substance we're using to cope with a concern. Can we cope with it without it? And so the potential for you to lose some of those traditional coping mechanisms because you're relying on a substance would be some of the main risks that would come with marijuana use.
All right, and kind of flipping that around a bit, what are some of the known positives of marijuana use?
So that's a tricky question. Because of the way that marijuana has been classified since late 30s, it was classified as a Schedule 1 drug. And so because of that, studies haven't been allowed to study what the long-term and short-term effects are with other medications on the body. And so we don't truly know what the effects are when it interacts with other medications, what the long-term or short-term benefits or risks are, because we haven't had those studies. And so I would anticipate, as there's some legalization coming down the line, and if the federal government chooses to legalize it across the board, we'll probably have some more of that. And there is some push right now for the schedule. So right now it's a Schedule 1 drug, and there's some legalization or talk about it being reduced in schedule. So that would allow some studies to be completed, but we don't truly know benefits or risks.
Okay. What are some ways of marijuana use that may be safer than others? Since there are many different forms of marijuana. Mm-hmm. As well as that now that there's that not only could you use it medically, but now with the legalization of recreational use. Mm-hmm.
So I guess I hesitate to answer that just because I don't want to give people an idea that any of them are safe. Mm-hmm. Because we don't know if they are or they aren't.
Okay.
And so I think ultimately people have to make that call for themselves on what they want to do, but we don't know if any of them are safe or if any of them are not.
So just to be precautious.
Absolutely.
That's understandable.
And I would say that if it's causing a problem in your life, it's a problem.
Okay. So with the recent legalization of recreational marijuana, has that changed the flow of incoming patients?
It hasn't changed the flow of incoming patients. I think it has changed those who are willing to talk about it more openly. And I would say that people are accessing it more easily. So because of it, some of it had to be kind of underground before, it's easily accessible and more easy to grab. And people are talking about it more, but I don't know that it has changed the use that we have seen.
Okay. So as you are a licensed alcohol and drug counselor, what would be the difference between patients who come in for alcohol versus patients for marijuana?
I would say one of the main things is exactly what you're talking about with there's a different stigma around it because it has been legalized. And I guess alcohol too, we have this idea that it's safe because it's legal, which isn't always the case.
Right.
And again, if it's causing a problem, it's a problem. So the addiction to marijuana is different than addiction to alcohol or other substances in that there aren't quite the same physical addictive qualities. Alcohol addiction can kill you if you're withdrawing from it. We do see a different withdrawal symptom. We do see different addictive qualities, but an addiction is an addiction. And so I would say that for the most part, there's some stigma around other drugs and marijuana and alcohol being safer because they are legal, which isn't always the case.
That's not always, yeah.
Yeah. Absolutely. There's lots of lobbying and legal things behind the scenes of why certain drugs are legal and certain ones aren't. And truly any substance isn't safe for us.
So you'd say that it's more about trying to use it minimally.
Or not at all. I would encourage people to always be keeping a pulse on if their substance use is leading to issues, and don't hesitate to reach out. any early intervention that's put in place for a substance concern, whether or not it's alcohol, marijuana, nicotine use, any of those early interventions are helpful. And unfortunately, we have a culture that is pretty accepting of some substances and not as accepting of treatment. And it doesn't have to be a bad thing. Treatment can be awesome, and it can give you some really good tools and skills to cope with things differently. And treatment's available all over the place, online, in the community, here at Winona Health. I mean, we're always willing to help people overcome anything that they're struggling with. And substance use, marijuana and alcohol are no exception to that.
All right. And where can people reach out to
Absolutely
get that help?
So there are, if you go online to the SAMHSA website, that is a great resource for anyone nationwide. And when it comes to the community, Winona Health, obviously, we're available. Our behavioral health unit, you can always call or go on our website. And then in the community as well, there's recovery meetings, and it doesn't have to be the traditional recovery meetings people think of. There have been some really great recovery meetings and recovery centers in the area as well. And an internet search, SAMHSA has that as well.
So one more question I have would be, do you believe that stigma would be bound to change as more research comes out?
My hope would be that, so that's one of the sticking points that we have, is even though states are legalizing it, as a federal government, it isn't legal. And so there is any point where the federal government can override the state's legalization. And at this point, because it isn't federally legal, it's not federally regulated. And at this point, there still isn't any studies being approved. My hope would be that as states continue to push for the legalization, and should the schedule be reduced, those studies would occur, and then we could have those answers on really having evidence. Is it beneficial? Is it risky? And which outweigh which? And so my hope would be that that would come down the line as some laws change.
Awesome. Thank you very much.
Thank you.
Thanks again to Nurse Donna Kamann, addiction counselor Kelsey Martin, and Dr. Bures for joining us on today's special episode of Culture Clique. To learn more about Winona Health's behavioral health services, visit winonahealth.org. To learn more about Donna Kamann and her practice, visit tinctureoftimehealthcare.com. To find more about Minnesota's legalization of recreational marijuana and the Minnesota Office of Cannabis Management, visit cannabis.mn.gov. Be sure to tune in next Thursday at 12:30 for a part 4 of our series, Legalizing Recreational Marijuana in Minnesota, when we talk to local government officials, law enforcement, as well as Minnesota Office of Cannabis Management. I'm Donna Alzate, and we've been talking about the health effects of recreational marijuana on Culture Clique.
Creating cultural awareness and understanding. You've been listening to Culture Clique. Support for Culture Clique is made possible by the Minnesota Arts and Cultural Heritage Fund. Culture Clique is produced by KQAL-FM on the campus of Winona State University. For more information, look us up on the web at kqal.org. And thanks for listening to Culture Clique.